Specialists charging excessive fees should be named and shamed and stripped of federal funding. Hi, I'm Dr. Matt, a specialist paediatrician practicing in Queensland, Australia. Today I'm going to be reacting to this news article from the ABC stating that 1 in 5 Australians who saw a specialist in 2023 were charged an extreme fee. What is an extreme fee? Why are private specialist appointments so expensive? Let's dissect this together. This article from ABC News covers a new Grattan Institute report that highlights what they say are serious issues with specialist medical fees in Australia. Here are the key takeaways. Overcharging is widespread. More than 1 in 5 Australians who saw a specialist in 2023 were charged what the report calls extreme fees, defined as more than 3 times the Medicare schedule fee. Out-of-pocket costs are soaring. Since 2010, these costs have increased by nearly 75% in real terms. For example, an initial psychiatry consult with an extreme fee specialist averaged $671. Access is unequal. Specialist care is described as a postcode lottery, with wealthier areas receiving about 25% more services than poorer ones. Public clinics can't keep up. Only a third of specialist care is delivered through public outpatient clinics, forcing many patients to choose between long waits or high private fees. Policy recommendations. The report urges the federal government to revoke Medicare rebates for doctors who consistently overcharge and to name and shame them publicly. It paints a pretty stark picture of a system where affordability and access are increasingly out of reach for many Australians. But is it the doctor's fault? Or have years of successive Medicare rebate freezes and chronic underfunding in our public outpatient departments led to this? I say ABC is wrong to parrot this report uncritically, which seeks to offload blame from the federal government for the crisis we find ourselves in. Reaction from commentators online has pointed out that Medicare rebate fee freezes by successive governments and rising costs for doctors have largely driven fee increases. I agree with this commentator. Defining extreme as 3 times the Medicare scheduled fee is problematic, since those fees were frozen from 2012 to 2020. Despite rising costs for rent, utilities, salaries, insurance and supplies, Medicare fees remain at 2017 levels. After the pandemic and inflation spike, those fees don't reflect current expenses. Would people be happy living in 2025 on their 2017 income? Why should health professionals? Many see this as a cynical attempt to blame shift, and I don't disagree. My take? Get it. Medical care can be expensive and delays frustrating, especially when your life is literally on the line. But blaming doctors isn't going to help. If anything, removing federal funding will increase patients' out-of-pocket costs, as fees will have to rise to cover the shortfall. Doctors are at the mercy of government policy, and rising overhead costs including insurance, administration, professional fees, the list goes on. It's also important to know that specialists can only bill for time spent with patients. For every hour in the consult room, then can be 1 to 2 hours more work generated that needs to be spent on administration time, such as writing letters, reading reports, and ongoing professional development requirements. Sure, some small percentage of specialists might overcharge, but the market should account for these. If you're charging too much, your patients will shop elsewhere. Honestly, these extreme fees aren't that extreme. They're only reporting the averages here for extreme fees, not typical fees. It costs me more per hour to see my physio than a paediatrician gets in Medicare rebates for an hour appointment, which is around about $150. It comes down to how we value our professionals' time. I say specialist doctors, who are the highest trained we have, time is invaluable and it should be recognised. At the end of the day, the hourly take-home pay is far less than listed here. My advice, shop around. Don't feel trapped just because your GP has referred you to a named specialist. Under Medicare rules, as long as the referral has the specialty listed and the condition for which you're being referred, then you can use it for any other specialist in that field. For example, from one neurologist to another. Ask ahead for fees. Don't let it be a surprise at the appointment. Ask if your GP can manage follow-up between specialist appointments in a shared care arrangement. Want to know more about public versus private care, Medicare gap fees and bulk billing? Do you think Medicare rebates should be increased, or should specialists be stripped of federal funding? Tell me about your experiences in the comments below, and don't forget to like and subscribe.